Kia ora tātou, everybody. Bruce Arroll's my name. I'm a professor of general practice at the University of Auckland and also work as a GP in Manureira in South Auckland. This is the Fact 1 course, which is very similar to my face-to-face fact course. So if you've done the face-to-face fact course, this is going to be very much a repeat of it. So you may prefer not to watch that, but you may find it useful as a refresher. So we're going to also talk about living with ease, because that's the subtitle of this e-learning, is learning to live with ease, because I've found doing the act and fact work that I've learned to live with ease much more so than I was before I did it. And this doesn't mean I learn to live without suffering, but it means that I can live with ease, learning to hold things lightly and breathe slowly and take the so-called middle ground. We're going to cover the history of fact. We're going to learn how to do the Qual 100. That's a single question which asks about the client's mood. So it goes like this. I'd like to know about your emotional quality after today. If 100 is perfect and 0 is worst imaginable, where are you now? And any score less than 60 is associated with a reduced quality of life. So the client needs 61 or 65, which is what they usually give, or more. We're going to learn how to do the work-love-play questionnaire. That's absolutely essential. So that's the engine room of this work. And that gives you the contextual history. So remember, we need to know the contextual history of the client. And we need to find out what their avoidances and escapes are so that we can reverse them. We're going to learn how to do behavioral activation, which is the most effective treatment for low mood. And also look at two mindfulness things, the mindful anchor and the holding lightly. We're also going to learn how to negotiate a score for the client to get more than 7 out of 10 likelihood of doing any particular task, because if they can't get more than 7 out of 10, they're probably not going to do it, is the reality. We're also going to learn how to do a number of ACT interventions with videos, and also the symptom distancing, which is the really fun part of the e-learning. Everyone loves doing that. That's where we put the distressing symptom on the horizon. We're also just going to look briefly now at just 6 core ideas in ACT, remembering that fact is ACT done in a shorter time scale, such as a primary care setting, a very busy outpatient clinic, perhaps in an educational setting. So that's what's online. So we'll just have a look at these 6 core principles, and then we will start the course. Thank you. ACT sees psychological suffering as normal, not driven by pathological processes. So we're not interested in diagnoses. We're interested more so in function. The mind can problem solve personal stuff and predispose us to suffering. The client's solution to their distress becomes part of the problem. For example, drinking a lot of alcohol or spending a lot of time in bed. And this is almost always the case. The aim of therapy is to increase psychological flexibility and to live towards our values, not symptom reduction. Any symptom reduction is a bonus. Remember, there's no delete button in the mind, so we need to learn to hold our negative cognitions lightly. And we'll be practicing that. Finally, we need to trust our experience, which may be better than trusting our minds. So thank you, and I hope you enjoy being part of the course.